So I'll just going to review a little history of surgery, describe to you what robotic surgery is, and then go over some applications. To take you all the way back to the biblical times, you can find sort of evidence of surgery going on way back when. But if you look through the history of surgery, many periods of time where we had big jumps in technology, other than the topics that I put on this slide, which is the idea of anesthesia, so that thankfully nowadays we don't have to cut on people awake, and the idea of sterility. Those were huge issues in the field of surgery. But as time passed, there really wasn't much sophistication to it. This is a scalpel from 2008, and it doesn't look too different from the knives they used to use way back when. It's actually still one of my favorite tools, but it's not too sophisticated. This is what our back table looks like before we're ready to do open surgery. We're just about to take out a kidney here using open techniques. And you can see from these instruments, they're not real sophisticated. They have different curvatures and different lengths, different creative things that surgeons have come up with through time, but really nothing too fancy. There's straightforward tools that we use in the operating room. These particular tools that I'm showing, you probably don't ever want to see us use. That's for when we take down the rib when we're coming through to get a big kidney mass. Well, fortunately, as of the 1980s, this idea of minimally invasive surgery was born, this idea of laparoscopic surgery. And if you haven't had laparoscopic surgery done, I'm sure you know somebody that's had laparoscopic surgery done. It's a form of what we call minimally invasive surgery. It's done without the incision, if you will. Minimally invasive surgery is done through small ports that are placed in the patient's body, strategically located so that we could get to the organ of interest. So it's done through what we call small ports. They're little round tubes that are placed into the patient. After the patient's abdomen or pelvis or chest area is insufflated with a gas. And we use CO2 gas. The whole world still uses CO2 gas for insufflation. Laparoscopic surgery is very basic. It's done using a handheld camera. It's a two-dimensional camera. You have to have an assistant holding the camera and following the surgeon around inside the body cavity as the surgeon's working at the patient's bedside with instruments on a stick, if you will. And these instruments are very basic. They're very two-dimensional. They scissor, they grasp in 2 dimensions. You can twist them externally and rotate them 360 degrees. But that's about as sophisticated as they get. As laparoscopic surgery began to grow in the 1980s, it became very applicable to these types of surgeries that were very straightforward surgeries. The gallbladder, the appendix, some basic colon surgery can be done laparoscopically. Doing lymph node biopsies can be done laparoscopically, and some general gynecology can easily be done laparoscopically. Surgeons who do these types of surgeries became very good at doing laparoscopic surgery. This is an example of the instrumentation. It's very simple. The surgeon puts their hands in there just like you would scissor. Nothing too sophisticated. And these would pass through the ports into the patient's body cavity to do the work that we would need to do. It does typically require not only an assistant surgeon using other instruments through other ports, but also that second assistant holding the camera, following the team around, if you will. Well, the neat thing, obviously, about minimally invasive surgery is that these small holes, as opposed to an incision, are great for less pain, quicker recovery, fewer complications because the surgical field is somewhat magnified. I like to use the gallbladder as an example because, thanks Edie, because a standard open gallbladder incision is quite morbid. It's a long incision that's underneath the chest cavity versus nowadays, and even up through 10 years ago, where that's just unheard of. Now they take out the gallbladder through these 3 small holes, and sometimes even 1 hole. So it allows the patient to have a lot quicker recovery for removing this type of an organ that's in a tricky spot that requires a big incision if we were to do it open. One thing interesting about minimally invasive surgery that was new in the medical field is that it was very much patient-driven. In other words, if a surgeon was in the middle of their career, they wouldn't necessarily feel pushed or obligated to have to learn laparoscopic techniques if it weren't for the fact that patients began looking for it. And in the age of computers and the internet, patients come in now very astute, and they see that these things are being done using minimally invasive techniques, and they're looking for surgeons who do that particular technique. And so as time passed, surgeons were pressed, if you will, to have to learn these techniques. If you look back in the surgical history, you'll see that through time, the learning curve for laparoscopic surgery really started to grow. Simple procedures, the learning curve not too difficult, but more complicated procedures were very difficult. And so this minimally invasive technology can really only be applied to very simple, straightforward surgeries. Again, its limitations are this 2-dimensional camera, so we don't see the image that we would normally see with our own eyes, and this fixed wrist instrumentation, which is very basic and simple. You can't get around corners. You can't do anything tricky with it. So it's really only suitable for these the narrow list of procedures which I already showed you. But what if we could take the advantages of open surgery, the advantages of having our hand in there, the dexterity and the precision and the feel of our hand, and combined it with a minimally invasive approach? You would then have robotic surgery. Robotic surgery is a combination of open surgery and laparoscopic surgery combined, if you will. It's the benefits of both combined into one technique. Robotic surgery, to put it in a brief sentence, is a computer-assisted form of laparoscopic surgery. If you look back in the surgical history at the history of robotics in surgery, it's very interesting. This is where we get the word robot. It's from the Czechs, and it just means worker. This technology actually created mostly in the science fields to do simple or complex tasks. I like to show this picture because when we show things like our coloring book, everybody thinks that we're going to show you something that looks like this, and we touch the button and tell them to take out the prostate or the uterus, and he goes and does it. We were at a conference once, and a layperson was overhearing us talking about the surgical robot, and he said, "Oh, that's great, we'll get rid of you darn doctors." And if you see how it works, you'll see that we're right there with you. But it does follow the standard robotic rules in this very litigious society that we live in that it's not to harm the human and it's not to harm itself. And actually, the error codes on the instrumentation are so sophisticated. It costs us about $400,000 a year for the service contract. If you look back in time over the history of robotic use in industry versus surgery, it's very interesting to see how slow we were in acquiring this technology. This is 1993 data here.